Welcome to Our Spain. How's it going?
It's going great, Tanya. How are you?
I'm good. Do you have an Our Spain for us to start this episode with?
I do have an ah. It's an Spain.
It's a good
So
one. Okay.
it's a good one. Yeah. So, we've talked about the menu del dias here,
Which we
and
love. Yeah.
which we do love.
Mm-hmm.
And so there's down the street from us, there's one of those conveyor belt, all you can eat sushi places.
So jealous.
Yeah. So it's not like, we have these other ones that, it's the all you can eat, but you order from the menu and they keep bringing it
Mm-hmm.
out to you. This is the one's the conveyor belt. So, like, it's fun and, it's a mad dash and
Yeah.
everyone's grabbing the plates and
It's a
everything.
little survival of the fittest. We did it in Madrid, but I've never been to the one here. You're when the good stuff comes out, you're like, it better make it to me. You're looking at all the other people, right? Don't
Yeah,
eat
you're
it,
looking
don't
at
eat
like
it.
6 tables away. You're like,
Right.
oh, don't you better not grab it. You better not grab it. So anyway, it's a relatively inexpensive for all you can eat. It's like, I don't know, like 17, yeah, well, it's 17 euros a person during the week. And then we
Yeah.
get the bill, and we with another family, friends of ours, and we get the bill, and the lady says, "Oh, it's Thursday, so every fourth person eats free."
Oh,
So,
wow.
yeah, so we paid for six instead of seven, and I was like, "Oh my god, this is like..." And one of my children, she puts buffets out of business. I'm like, they
Mm-hmm.
have really lost some money on
Right?
us today.
That's when you want to you do want to take people like that to the buffets because
Right.
you really do want to get your money's worth, right? So it's kind of nice but you just needed one more person. That person you could have literally taken someone off the street.
I mean, there was seven of us, and
Right.
yeah, I was like, we should have just had one more person. Yes, we can have two people eat for free.
Oh
And then
my
all
God.
morning, of course, I was telling the kids, you are not touching any food. We are going to eat at 1:30, and you will eat
Mm-hmm.
then.
Right? And that's going to be and you're not getting dinner either because
You're not
that's
gonna,
it for
for
the
2 days,
day.
so
Right.
eat.
Yeah, the prices on those are like if you can go during the week are like really makes sense. They really go up during the weekend and holidays and things to like
Right.
25 euros. But still, if you're someone that eats a lot and you like, I mean, they're great, I
Well, I
think.
mean, 17 euros is like the price of 1.5 rolls, right?
Mm-hmm.
So we definitely ate more than 1.5 rolls. You know what I mean?
Yeah, that's true, especially the sushi ones. There's other ones that do like seafood and like kind of more like Chinese style stuff, I
Hmm.
think, that we've been to. But the sushi ones, you really feel like you're getting your money's worth, right?
You really
That's a
are.
that's a lovely Austin. I love that.
It was.
Yeah. We're gonna have to try that one because we do love an entertaining meal of any sort, right? We have the sushi buffet that has the little cat that goes around, the robot cat.
Okay, yeah.
Yeah,
Hmm.
who's like, and we love
But
that.
that
But
scares me. That's a little freaky. That's a little
what?
that's a little 2001 Space Odyssey for me. That's like
We love it. But when it gets busy and the cat's coming and all the kids are like, it's gonna be for us, it's gonna be for us, and it like whoop, and you're like, oh, okay, all right. Then you gotta like ask, could you please send the cat our way?
Oh, will tell you what they just implemented at this is they also have now a menu that you can order from a la carte, and it's 1 penny per item, and they deliver it to you immediately, so you don't have to wait
Oh,
for it to come around. So if you're like really impatient, for an extra penny, you can order your nigiri and your sashimi and your seaweed
okay.
salad and stuff. So
Well, I would say that's a good idea as well. And I think
yeah,
on the weekends they generally have more. They do charge you more, but they also have more things available on the free menu.
right.
So you're kind of that's what I've noticed.
And I will say, for a suggestion for anyone that does do these kind of buffet kind of places, especially at lunchtime, get there at the beginning of lunchtime, because they've made what they're
Yes.
going to serve. And if you're like, I'm going to show up at 2:30, it's like every like
No.
20 seconds a plate comes by, you know.
Yeah, and we go to one that's seafood, and I will say, like Jawad likes the crawfish that they have. And
Hmm.
again, like you need to get there because there's a point where that runs out.
Right.
So then if you get there later, yeah, they probably aren't going to have it. So you do, yeah, that's good advice. You got to get there early for
Yeah, if you get
sure.
there late, you're getting bread
Yeah.
and rice.
And and some of them include drinks and some of them don't also.
Hmm.
So that's another thing. Like might be 17, 18 euros plus the drinks, and then the drinks are like 2, 3 euros a pop.
Right.
So and
Yeah,
there's some
ours
that
was,
included.
but we ordered like 2 big 1.5 liter bottles of
Yeah.
water, so it was, they weren't expensive considering what we ordered. No one was getting
Yeah.
their own sodas. That's what
Right.
I put my foot down.
But one of them has like free beer and wine. I
You're
don't even
right.
know how
Yeah,
they do it. And
I don't know
and
that.
so very Spanish too. nobody's falling out of their drunk,
Right.
right? It's like they're just having their bottle with the
Yeah.
table and leaving. So it's very like it's very put together for that type of thing. Like I can think of places I've lived where if they were offering free wine, that no one would
Right.
want to be there.
No, no. Like those
Other
like
than the drunks.
those like bottomless mimosas, Sunday brunches. Yeah,
Right. Yeah, you
that's
don't want to be there.
you take a cab to those. You
Yeah.
don't drive there.
No. Okay, so funnily enough, this episode was not about buffets
No,
or
it wasn't.
food. This is actually about healthcare, which maybe the two are related a little if you've been eating too much, but maybe we should skip on to our healthcare episode in case that's what people actually tuned in to hear about. Just a
I think
suggestion.
so. Yes.
Where do you want to start? It's good. We've got a
Well, I
lot of
mean,
things to talk about.
we do have a lot of things to talk about. So I guess we could just start with our listeners that are thinking about moving over here. The most important thing to know is you have to have your healthcare situated before you apply for your visa.
Yeah.
So you have to have private health insurance paid for a year up front before you get here, and it has to have no copays. It has to, it has there's certain limitations, and we'll get into brokers and stuff later. But when you get to that point, if you go to a broker, you go to an insurance company, they know if you just say Visa insurance, they know what they're supposed to sell you.
Yeah, they know what it is. So you don't have to guess, is this the right one? Yeah, they'll be like, okay, you just tell them, I need it for a visa. Boom, you're done. Yeah,
Right.
They know. And it's complete coverage. And to jump into the coverage and what you get here, it's amazing. If you're coming from America, if you're coming from a country without any kind of national health system, it's amazing what you can get. So that you have complete coverage. You can go to the doctor. There's no copays. You're not doing anything. And I mean, we pay, I think when we moved here, we paid around 250 a month for three of us. Now it's like 300 for three of us. I mean, obviously it goes up like it does everywhere else as you get older. And then so we're two adults and a kid, and you're one adult and two kids, and I think yours is probably a little bit less.
Yes, because of the youth, because of those youth and their freedom from elderly ailments.
But I mean, that's amazing. When you see that it's just, I mean, and for that you're never paying anything. We go to the emergency room. We're getting the medicine. So let's start that. You're not paying anything for doctor visits, for X-rays, for MRIs, for going to the emergency room. Anything you need medical, you will pay extra for. You'll get one eye exam, I think, and one dental cleaning, more or less, probably. And then everything else related to eyes and dental would be extra. And then your medicine will be extra. But the medicine here, again, also much, much, much cheaper. So unless you're on something really crazy or on a lot of things, the cost of your medication is going to be a lot less. But you can, in all those three cases, for prescriptions, for dental, and for eye care, you can pay extra and take a look at what that costs and what you need and whether that makes sense for you. And that would be an extra thing that you do not need for your visa, but you can get if you need it.
And I've been very happy with it. We've been here 2 years and we're still on the private health insurance. It has been great. I mean, for what we pay for the year would be, less than what we would pay for a month if we had to do private health insurance on our own back in the States for a month, right? Like for what we get for a year, you'd have to pay for a month if you were lucky, right?
And it's really great. And we'll get into the Spanish healthcare system in a minute, but as far as like we've both been using the private healthcare, and I've been using the other one, but for the private healthcare, we just like, I don't know. I have a different mentality now about healthcare, and I love it because it's very preventative. It takes a little while to get used to the fact that you can get all these things done without paying. Right. And if you are, I mean, we've always been self-employed, so our healthcare in America always sucked, and we had to pay it because we kind of got the ones that were like less. But if we got really sick, hopefully it paid for something, which it probably wouldn't have at the end of the day. But that was the theory. And so we had a lot of copays and out of pockets and deductibles, and we would have been paying $10,000 easily if something happened before anything kicked in. So here it's like, Zena was jumping around on the couch one day and she banged her foot on the coffee table. I bet everyone's been there, right? So, I mean, in America, and I kind of looked at her foot and I'm like, it feels all right. You're wiggling all your toes. It's fine. I would never have gone to the doctor for that in America. Ever. I was just like, you know what? It's like, let's just go have a doctor look at it. It doesn't going to cost us anything. And it was like 8:00 in the morning. She had to be at school by 9. So we went down to the emergency room. We were in and out of there with an X-ray in 25 minutes with an A-OK and at school on time.
Wow.
Like that
I mean, that's amazing.
scenario would never have happened
No,
in
no.
America. Not where I've lived anyway. Maybe in the middle
No.
of nowhere in some place, I don't know, but not in any of the big cities that I've lived in there. That was
Right.
like, I was like, I can't believe. I got home and I was like, we went to the doctor, we had an x-ray, we had a doctor look at her, and I got her to school on time.
Right. Yeah, I mean, that's pretty amazing. That's pretty
Yeah.
unheard of,
I would
right?
say, but it's normal. But that's normal because the emergency rooms are kind of, I mean, they're not empty. It's definitely these private hospitals are filling up now. There's more people coming. There's more people using them. Spanish and people from other countries. I mean, everyone's using
Mhm.
them because everyone has, you know, a lot of Spanish people have the regular healthcare in Spain, but they also have a private health insurance for things that you want to have done a little quicker,
Mhm.
or you know, that type of thing. So you know, the emergency rooms are, and there's a lot of preventative care here. You can get all your preventative care done by the national health system or privately with your
Mhm.
insurance that you're getting for visa. So there's not just this like desperation of need for things that could have been prevented that end up in the emergency
Right.
room in America,
Right.
right? So you're just, so it's just a very different scenario, and it takes a little while to get used to it, but it's all, we've had a great experience too.
But what I haven't done, and it's something I'm looking into now because we've been here long enough,
Hmm.
and I'm thinking about, because after you've been here for a year, you can buy into the national healthcare system. Oh, but I would also like to say, once you've been here, I think it's 6 months. I'm not sure. You can get what's called the SIP card, even though that doesn't put you in the national health system, it puts you in the database,
Hmm.
right? So if you have private health insurance, you still want to get a SIP card, because then it kind of has all your information. So if you end up in the emergency room, they can pull you up and they know who your details are, and what's
Yep.
going on, and those kinds of things.
And also
But
sometimes for the kids, they want that for school as well, for
right.
that reason, I think, because a lot of the schools, will get into this later, they also have like nurse's office or a doctor in the school, so they have a whole system and they can log into things. And we
Right.
got the SIP card because when we moved it during COVID, we got the SIP card that doesn't give us the actual healthcare, but it gave us the free COVID vaccinations,
Hmm.
and we had to have the SIP card to do that because they wanted that tracked of who had got it and how many you've had and all this kind of thing. So that was all tracked on the SIP system without us actually paying into it or having any other healthcare advantages.
Hmm.
And
Well, okay. So I guess, so what I'm saying is I'm going to look into getting it, because we've been here long enough,
mhm,
and I'm thinking maybe we should, because now I've been here long enough, I don't necessarily have to have private, so it's something I will weigh. Not there yet. I know a lot of people keep both, and maybe will probably would
yeah.
keep both. But what has been your experience? Why don't you? I'm going to play
What
interviewee
I
here,
share.
interviewer. It's like, so what's your, tell us people about your experience with the national health system. When do you use it, and what's been your experience with it? Like, what do you choose? You're like, okay, she's fallen off the couch. Which hospital am I going to?
Yeah, I mean, when we first moved here, we had some kind of emergency, and I can't remember what it was, but we went to the, I don't think IMED, which is one of our private hospitals, which there's now two of now, one in the city and one just outside of the city. I'm not sure they were around, or we hadn't heard about them yet
Okay.
because we didn't have a podcast to listen to and get all the details.
Right.
So we were like, I'd never heard of IMED. So we ended up in a Spanish hospital and we got help. And I'm not sure if we paid, but we had a really good experience there. We might have had a SIP card at that point. But anyway, we went and we had a very good experience, but there was not a lot of Spanish being used. I mean, a lot of English being used, sorry. But they
Hmm.
did go find somebody to help with the, it was like a nurse that spoke some English. Like they like ran around the hospital and tried to find somebody to come help us, and it was a really
Okay.
good experience and it was fine. But up, you know, from then on we have been using the private hospital because I think in a lot of these cases there's the need for, you know, my Spanish is pretty good and I can get through a lot of things, but not things I that are new that I don't know the vocabulary. So if someone's explaining something new, medical to me, it's probably going to go in one ear and out the other, right? So it's
Hmm.
nice for me to go to IMED because I can speak to somebody in English. And but we are I'm now autonomo, so I've been paying into the system, and I now had, and then I went and got my SIP card switched to a Spanish healthcare SIP card, which I can then use. And we have a, you know, we live in a small town. We have every town, and the city presumably has lots of them, a centre de salud where you can go and you're kind of registered with them. And you can go in there and you can talk to, how it works in ours is that you have to kind of, you can talk to, and you can get an appointment with a nurse, but you can't get an appointment with a doctor. The doctor has to decide that they want to see you, or you have to
Okay.
kind of go in and say, I want to talk to a doctor, and then they'll interview about what it is, and they'll decide if you want to see a doctor, right?
So the nurse is like the gatekeeper,
Yes.
almost like in the States where like your GP is your gatekeeper to see if you really get that thing taken care of.
Well,
Like,
I
is it
feel
like
like
the
you have
first
two
step?
gatekeepers, because you have the front desk and then the
Okay.
nurse and then the doctor. So the doctor
Okay.
obviously does all the prescriptions, but I think the nurse will consult with the doctor without you if needed. But if you need to just sort of like go in and get blood done, this type of thing, you can just make an appointment. There's times that they do that. But what I tend to do, because I have the private healthcare, is I will go to the private doctor and make sure I'm fully understanding what's going on. And
Okay.
once I know what I need, and once I know what the subject matter is, I can then go to the Centre de Salud and make sure that all my prescriptions and stuff are in my SIP card system, because then I'll be taking advantage of the discounted price.
What's the discounted price? What's
Well,
how
it
much
depends
cheaper
on
does
your
that work?
drug. So I mean,
Okay.
one that we have in our family, I think was like, it was €6 a month. I mean, really expensive, €6 a
Okay.
month, but it was like 33 cents a month.
Oh wow. So I mean that's a
It's a
huge
big
discount.
difference.
I
I
mean,
mean, and then the other thing is that you have like, there's an app, and there's an app for the private health. I have an app for the private hospital I met. I have an app for the Spanish system, and I have an app for
mhm.
my sanitas. So I have all those three apps, and I can do a lot of things in there, like making an
Sanitas would be your
appointment. My
insurance in case people
insurance,
don't
yeah.
know. Right.
So I can make appointments in those. You can call Sanitas or your health insurance. You can call IMED and make appointments, or you can do it in the app. Same goes for the nurse at the Centre de Salud. And so this is an example. I was looking through all Zena's vaccinations, right? And
Mhm.
it looked at it, and in America we had, the whole page was like, she's had 1 of 4, 2 of 4, 3 of 4, but she had never had the 4 of 4, right? And I went to the I was like, let me go talk to a person in English about this, because this is incredibly complicated, and I do not know the vocabulary for this. I don't even
Mhm.
know the vocabulary in English, because it's all the different vaccines and what do they do, and you can spend time on Google figuring out what they are. And I'd had someone look at it when we first moved, so I definitely like had somebody look at it, and they said, oh, you just are missing one. But then when I went back and checked it now, I was like, it seems like she's missing more. So that doctor
Mhm.
was like, yeah, you can do this, but you're going to have to pay for them if you want them, because it's not the age that she would have had them.
Right, right.
Everything.
We're doing the similar thing with my youngest because
Yeah.
she has a vaccine that is scheduled for America time.
Hmm.
And we came here and they're like, it's 100 a shot and she needs two of them. And I was like, what? They're like, yeah, we give that at birth here. I'm like,
Right. Yeah. So
oh,
now you're out
so
of it. You're out of schedule. You're going to pay, right?
right.
Yeah. And then the HPV one was like, I mean, literally 6 months ago, it was 2 shots, and now it's only one. So they also like keep
Right.
changing, right? So then I took all this information that I had of all the shots that maybe she should have, and I took it to the Centre de Salud, and I was speaking to the person in the front, the first gatekeeper, and then that person got the nurse, because, she didn't really know about this. So I then was talking to the nurse, and she was like, well, we don't do those in Spain. We only do 3 of those in Spain. So she's fine. You don't need
Okay.
it. And I was like, well, if she ever goes back to another country, I want to make sure she's globally vaccinated. Because she might leave Spain at some point and go live
Mhm.
somewhere else. But it was funny that they have a different system, so you do have choices to make, whether you want them to be fully vaccinated. That, like in Spain, they've decided that they only need 3 of that vaccine instead of 4, and that's what they give. So that
Right.
was an example of like me just using both systems. And then for myself, it's like I try and do as much as I can at the Centre de Salud, because it also helps me practice my Spanish, and it's
Mhm.
local here to us. It's very easy to get to, and most likely wherever you live, you'll have one within walking distance of where you are. So it's very, very convenient, and they know everything that they need to know to help you. So
And from what I've understood from, I've heard this from expats and from Spaniards that do have both. Another reason why they'll have the Spanish health system, especially if they are getting up in age, is, I mean, neither of us are, but
no,
other
no,
people
other
are.
people.
Other people. I paid a salon to give me the 3 gray hairs I have on my head.
Right.
So
You're so young that it's cool to be gray.
it's cool. It's platinum. It's platinum blonde. So, but what I have heard people have said, and it makes sense, is that you want the private for your elective and your kind of ongoing preventative care. But if you have a cancer or debilitating diseases and like really kind of like life altering traumatic kind of
Hmm.
illnesses, you want the public, because that's from what I've heard is that's where the government money's going for research, and that's where those doctors are. The doctors with those kind of know-how is
Yes.
what I have
And
heard. So
I did sadly meet somebody here whose husband had, I think, died of cancer here, unfortunately, when they moved here. And she had said that exactly that. They had started in the private healthcare system, but once they got into the public one, the care was like astoundingly good compared for
mhm.
that type of thing, you know. But if you've
Right.
like twisted an ankle and you need it checked out and you want it, you know, you want it x-rayed and da 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 da, like you can get that done in, you know, very quickly. And we get all of our blood work done at iMed because it's so much easier. You can just go in
Mm,
whenever you want, get it done, and then you can take all of that paperwork. It all goes back and forth. You have that paperwork, it comes to you. You can take it to another doctor,
right.
the Centre de Salud, whatever you want to do, and have anybody evaluate it for you. So
I will say what or a shock or surprising or a is when you leave the doctor here, you just leave. Like there is no checking back in with the front desk.
right.
Like you just walk out, and if the only times I've had to check in is when my doctor said my printer's out, so go to the front desk. They have the summary of
Right,
today,
that's so
even though it's in
true.
the app. But if you want it, you have to go to the front desk because my printer's jammed.
Right,
So,
that's
but
so
otherwise,
true.
she's printing it out and shooing me out the door at the same time. Here you go. See you in a month. Don't forget to make your appointment. Blah blah blah.
And
Right.
you're done. Yeah, and
Um.
actually in iMed now, you don't even have to check in because you can do that on your phone. Now you get a text
Right.
message. It's like, do you want to check in? So I literally go into the hospital, wait, go see the doctor and leave, and I don't see anybody else.
Right. Yeah. Same boat, but I think you and I have discussed this before. The IMED in Burhasot was is architecturally challenged in that it is a new hospital, but for some reason they thought only three elevators were enough to service what 10 floors,
I
11
don't
floors,
know.
and so you're always waiting. So don't make the mistake of checking in on your app when you're on the ground floor. At least wait until you're in the elevator, because you might wait a good 10
I
minutes for
have
that
almost
elevator,
missed an
and then you
appointment waiting for the elevator, and I'm not kidding. I got there 25 minutes early, and I was like, "What is going on?" Yeah, no, it's really
Mhm.
crazy, and they don't feel slow when you're going up in them, but they must also be incredibly slow
Right.
because
I
there's
think well,
yeah,
there's so, and then I think there's also off topic. I think there's like 4 levels of underground parking too. So I think it's just even more
that's true. But
floors.
I think those are different ones. But maybe some they have, yeah, that is totally off topic. But it doesn't function. There are
It
stairs.
doesn't
Also,
function.
there's no the stairs are this way sign. So everyone's standing there,
Right.
half of whom are probably quite capable of going up the stairs, but they don't know the stairs are there. So
Right. Right.
everybody's waiting. And it's like, okay, so now I know if I'm on like the 1 through 3 or something, I'll take the
Just
stairs.
go up those. Right.
Yeah, that's not a great thing about, but everything else is good there. So yeah, I really like having both now. It's a nice thing. And the SIP card has a very good app for your medicines and everything, and it tells you when your next medicine's coming up, so you know, like, because they'll give you like, this medicine for a month. So if you picked it up
Hmm.
at certain time, it'll be ready for you to pick up again at this time. That you can't pick it up early. If you need to go on vacation
Right.
and you need to get drugs early, you need to pay for them out of pocket at that point. But the difference,
Okay.
I mean, that's probably not astronomical, but that is what you would have to do.
Right.
They will not be like, "Oh, you're going on holiday. Okay, well, let me give you more." No, you'll pay
Well,
for it.
I've had, and I don't know about you, but I've had an experience where one of my daughters is on a medication that's every month, and so they'll give me the 3 months in
Hmm.
advance. And my pharmacy has allowed me to get all 3 months at once. They just take all the prescriptions at that time. So
Yeah.
I think you might be able to arrange with your doctor that I need. Can you get the next 3 months? So that might be something.
Yeah, you might be able to do it with the doctor, but you probably couldn't get that fourth month. You know what I mean? So you're
Hmm.
probably stuck a little bit. I mean, there's no need to be stuck. I mean, the medicine, it's all handleable. If you have to pay it 1 month and it's free the rest of the time, it's not like
Right.
it's it's we've all come. If you're coming from America, we've all come from a way worse situation. So I would say it's a very, very, very good system.
Now, I don't personally, well, I do know people. I haven't had the conversation. Have you had any conversations with expats that are actually from within the EU? How, if they have like, what's their experience with the healthcare versus us that are coming from America, that they
Yeah.
don't, do they have to buy into private, or is they
No.
get, if their
So they
country
have
has
an
it?
agreement within all the countries. So if you kind of get your public health transferred from that country to this country. So
Okay.
if you have, so this is what happened when England left, is that that public healthcare link got also disconnected. So that's something I don't know if it got back connected again. I know that Brexit is probably an ongoing thing that'll be ongoing for the next 20 years when they try finally go back in and fix things. So I don't know what the current status is, but essentially that did get sort of disconnected. But if you're from an EU country, then there's an agreement that everyone takes care of everybody. That's part of that.
Okay.
So you're good. And since we touched on pharmacies, let's talk about pharmacies because that's a very different scenario that we've had very good experiences with the pharmacy. If you're thinking of like
Right.
CVS or Walgreens or the Target and you're just going in and there's like kind of a person there that's just filling drugs and giving them out, if you try to stop one of those people and ask them a question about something, it's like, oh, I've got drugs to put together. This is not my job to
Right.
worry about your sinus infection
Right.
unless you find a nice one. But I'm so no offense to all the people working there. I know you're working really hard filling medications and that's taking up all your time and there's 25 people waiting for those medications. So it has to get
Right.
done, right? But that's not their job. And here it's very
Right.
different. It is you can go to the pharmacy for care without even going to your doctor. And that is another thing.
It's kind of like an urgent care, right? You
Mhm.
can go there if you're like, I have a cold, and they are like mini nurses,
Yeah.
right? They can tell you what you need. They ask you your symptoms, and they give you like an array of like you can
Options,
try
yeah.
X, Y, and Z. Oh, I would like to say because I think this is something interesting coming from America to here, and I know this is kind of more universal everywhere, but America is different. Is that in America, pharmacists are filling prescriptions, literally filling prescription bottles. And here, pharmacists are not filling prescription bottles.
Oh,
They come in
no,
a
yeah.
box that is either 30 or 12 or 7 pills.
Mhm.
It's either a little bottle. They're already pre-done. So they're just pulling out something out of a shelf and handing it to you. So they aren't wasting their time with these little gadgets, counting pills and
Right.
putting them in orange bottles and all
And I
that
don't know,
stuff,
you
which
might not have had this experience, because, or maybe you have. Like, I think it's really cool. Some of the pharmacies are super fancy, and they punch the stuff in, or they slide your SIP card, and then the drugs pop out in a little machine behind them, and I
like in
love
what
it.
yeah, what do they call those things? Like in the olden days where cash registers weren't allowed to have cash because they didn't trust the employees, and it would go in that little tube,
Yes,
or the old bank tellers and would suck through the
yeah,
air tube. Like that's kind of how it
that's
is. It
kind of how
comes
it is. We
drops
have
down.
those at
And
Consume. Don't you? Haven't you not
oh, do
seen
you?
them? Yeah.
No, I haven't
Oh, I
seen them
love
here.
it. I
No,
love it when it happens when I'm there. They're rolling up their money and putting in those little suction things. I love it. Yeah.
right.
It's totally like 1920s bank, you know?
It's totally awesome. And when I go to a pharmacy and they have some sort of weird dispensary
Hmm.
machine mechanism thing, it almost makes me feel like I'm a little kid at the
Right?
dry cleaners watching the clothes go by. I'm like, oh, this is so
Yeah.
exciting.
It's like your candy's coming out or something. Anyway, so,
Yeah.
that's very true. So they're not wasting their time, that they have time to talk to you. And it's also Spain. So let's have a mini our Spain moment, which is that it's totally fine for them to sit there and chat with you for 25 minutes, even if there's five
Right.
people behind you, and just you have to chill. Like that's what's happening at that moment. And that's the person they're talking to. And no one's going to feel rushed or, out of or
Right.
annoyed or whatever. Like if you don't have time for it, then go get a coffee and come back. Like, like you wait so you can talk to the pharmacist and they will. So it's kind of like having a private nurse, really,
Mhm.
because there are certain drugs that, if you go to the grocery store or one of these Target type stores that have sort of everything, there is no pharmacy in those places. There is a beauty section where you can get, toothpaste and shampoo and
Right.
maybe something, little, but there's no drugs in those places. You have to go to the
Right.
pharmacy. So, they can give you drugs that are behind the counter because they've decided to give them to you that aren't prescription, but they're not
Right.
just out there for you to grab either.
You're not going to pull a bottle of aspirin or
No,
ibuprofen off the
no.
shelves here. Like everything is behind the counter,
Hmm.
whether you need a prescription or
Yeah.
not. You have to go through them to get them, and they're not like judging you. It's just how the system is,
Hmm.
right? So in our pharmacies here, so people haven't been, they're like an American Starbucks. They're on every corner. Like every block has a pharmacy.
Hmm.
Again, how are they all staying in business? That they're, I mean, in the city at least, they're on every
They are
block.
everywhere because they're being used for everything. I
Right.
mean, yeah.
But they have very little in the actual shop. Some are bigger,
Yeah.
And we'll have a lot more like kind of beauty supplies and kind of fancier body
Right.
creams and homeopathic kind of
And maybe a
things
section of baby stuff if you they some of them have like sort of maybe some bottles or some
and
like
formulas
formula, not
and
maybe like pacifiers and things that you could they might have a little baby section of sort of necessities as well, so that would be a good place to stop.
but they won't look like a CVS. It's not going to
No.
be a huge thing, or what is the one in England like a
Like a
Boots, right? It's
Boots.
not going to be
No.
this huge emporium of
No.
things.
No.
Um, and we do have stores like that, but you can't get your drugs there. You
No.
can't get any kind of drugs
I can
there.
get vitamins at the grocery store. So some minor like a consumer
Minor
has like
ones,
vitamins
right?
and sort of things like that. But yeah. So I mean they're very convenient and they're very helpful. So it's a good place to stop if you're thinking like I do need to see a doctor, but maybe I just need somebody to give me the right drug. And then maybe if I feel better tomorrow or the next day I don't need to go to the doctor. That's what the pharmacy is for. So there's a kind of there's a buffer there which I think is really really nice. And they also have 24-hour ones. So, when you're thinking about, oh my God, everything closes in Spain, the pharmacy is not like that. A lot of them will, most of them will, but every area will have one that is open. So when you go into Google and you search for pharmacy, if it is like 3 o'clock in the morning or something, there will be a pharmacy open somewhere close to you. If you're like where we are, it might be the next town over. So you will have to get in your car to
Right.
go to it, but it will be close ish to you. And you probably have one in walking distance, I would imagine.
Well, no, I've looked because there is one sometimes, but
Hmm.
they do change.
Yeah.
And one time I had to look, and it was across the park. It was,
Okay.
you can walk it, but like at 3 o'clock in the morning, you
You
don't
don't
want
want
to
to walk
walk it.
it.
So
Yeah.
you're
But
just not that you would feel unsafe. You're like, it's 3 o'clock. I just want to get there and get home.
plus,
Right?
plus
You're
I'm
like,
feeling like crap. So really,
yeah,
I need this thing now. I'm not in the process of getting my exercise at the same time. Yeah, but
right.
it's very that is very helpful, I think. So that is the kind of the three things that you have are your public healthcare system, your pharmacy, and your private healthcare system. And whatever combination of that you have will absolutely be great for whatever you need.
Hmm.
And then the schools, if you want to get into the schools, we kind of touched on that earlier. A lot of the private schools have a nurse's office, like a proper one. So
Right.
if your kid, something happens, I mean, obviously there might be something that happens that they then have to go to the hospital. But if they're just like feeling sick or they got a sore head or a sore tummy or something, they will have been looked at by a nurse before they send them home, which is also really nice.
Right.
So you're not like picking them up to then take them to whatever you call the little emergency care places or something. It's like, no, at that point, the nurse has been like, oh, they seem fine. They just need a rest or whatever.
Well, I'll say at my daughter's school, they actually have a doctor on staff too. He's not there every day. He's there like 2 or 3 days a week and does doctor things.
Okay.
And we had trouble getting a prescription because the school had said, "What's going on with this prescription?" Because my daughter was taking it at school, and I said, "Well, they switched it. We can't find it." And she said, "The doctor's in. I think they have it at the pharmacy in the town where the school is." And she's like, "Me see." And the doctor wrote the prescription. They got the prescription from the pharmacy. And then they sent me an email and said, "Send your daughter with 30 euros for the prescription."
Oh, that's
Or 15 years
amazing.
or whatever it was.
Hmm.
And it was 30 because we got her 2 months supply, sent her with 30 euros cash tomorrow. And I was like, that
What?
is, yeah. Where am I? Oh, Spain. That's right. That's where we are.
Yeah. Yeah.
Spain.
Spain. Yeah. No, I mean, it's definitely, I mean, there's obviously a lot of reasons why everybody ends up moving to a different country. One of them for us was the healthcare,
Hmm.
because we had both lived in places where we had a better healthcare system. So I was fully aware of the downfalls of the American one, and it was becoming very frustrating. And we were like, we're getting older, and this is only going to get
Hmm.
worse and more expensive and more ridiculous. So when we moved, it was very refreshing, but it still takes some time to get used to the fact that you have all these things that you never had
Right.
properly. And I'm sure there's people coming that had a really good job with a company that gave them really good healthcare, and it's going to be different for them. But for everybody else that's more like my experience, it's, we had paid $3,000 for Xena to have a couple of stitches in her chin when she did one of those little
Hmm.
kitty fall off the thing and hit the chin. And
Right.
it's like, really, it's a lot of
Right.
money.
No, it's a lot of
Yeah.
money for something that they're just putting a needle through her chin.
I
And,
was like, can I do
yeah, you're like,
that?
honey, next time. bite down on a knife, and I'm
Right.
just gonna.
So yeah, so I mean, I have to say from my experience, it's been kind of really amazing. And then the vision, I went to a one of the places that sells, like a shop that sells glasses, so you can get your proper medical vision thing done that you need, where they look into all your, you know,
Right.
veins and stuff.
Where they dilate your
Yeah.
eyes and you can't see the sun for 7 days.
Yeah,
Yeah.
but I went to like just a shop to see if I, because I was starting to feel like I needed glasses, and I was just for reading and things, and I went to the shop, and this was several years ago, and I got a pair of glasses for reading, and then I just went back a couple of days ago thinking, I mean, it's got to have got worse, right? So, and it's a free eye exam every time
Because you're buying
because
the
you're buying the
glasses, right?
glasses. But this time I
Right.
got the eye exam, and I didn't need to change anything, so I didn't spend any money in the shop. So I
Oh,
literally just
okay.
walk in, get the eye exam. She's like, "Well, it's really fine. Nothing's really changed that much." I was like, "Really great." So that was like, "Oh, yay!" But I didn't have to buy anything. But you know, so there's, I mean, that's probably very similar to other countries. You can get those eye exams in all the places that do the glasses, and so I mean, that's, yeah,
Right.
very
I mean,
easy.
I'm going to IMED to get my eyes checked in like two
Well, there you
weeks
go.
or 3 weeks. Whenever the kids go back to school, I have an appointment to get that
Yeah,
done. Um, so I mean, I think that's, I'm excited to do that. My daughter did. She went in for her like physical, and when we went in with the vaccine record thing, and they're like, she should get an eye exam too, and
mm-hmm.
so they're like, go across that door and make an appointment, and so that was
Yeah.
pretty good. I mean, I'm very happy with that that
That
stuff,
all that system.
right?
Yeah, but I will say, and I think we've sort of had a bit of the same experience here. You're no one's, and I think it might be a little different if I was really fully embedded into the healthcare system,
The
possibly the
Spanish,
Spanish
the
healthcare
national health,
system.
right?
But you're looking out for yourself. No one's going to be coming up to you. Like, I will get emails from IMED sometimes, and from Sanitas, my health insurance, sometimes, sort of telling me things that they think are age appropriate for me, right? But I'm
Mm-hmm.
not. No one's like telling me, "Oh, it's been X amount of time since you had a mammogram. You need to go in and do it." Like, you have to
Right.
be really on top of your own healthcare and making sure you're doing stuff. Because I haven't. I will go back and see the same doctor for things, and it's nice to see the same doctor and all that. But she's not calling. I'm not getting anything from her saying, "I haven't seen you. How's it going?" Like, you
Right.
know, I'm in charge of making sure that I get all my stuff done, and Xena gets her stuff done. You know what I mean? Like, that is the
Yeah, that
system.
is, it is a different, it's taken some time to get used to, because I'm like, wait, there's no one's kind of holding my hand, right? And there's also not a money making operation. So I feel like there's, back in the States, they're telling you you need the colonoscopy now, because they're going to make a ton of money giving that
Right.
colonoscopy.
Yeah.
And here they're like, okay, remember you need to do it, but we're not going to
Mm-hmm.
remind you. But you're doing it here, so remember
Right.
to like make that appointment. And you're like, well, I had one once. I'm never going to want to remember to do that again.
Well, and I will say, speaking of that, the for the ladies out there, no, nobody enjoys getting mammograms. Let's start there. But if you're gonna have to do them, which you do, the way they do it in Spain, so much better. At the private hospital, so I don't know how they do it in the public hospital, but in the private hospital, my experience in America was you go and get a mammogram, and then at some point in the future, after you've had a heart attack, they'll send you a letter whether or not it was okay or not, right? So in that
Hmm.
time frame, you're like, oh my god, whatever, like, and it takes forever for these letters to get around, right?
Right.
And then if something's wrong with it, you get a letter saying there's something wrong with your mammogram. You need to come in for a sonogram. And then, of course, you're really freaking out by that point,
Okay. Yeah.
because,
Yeah.
and of course, you can't get an appointment for another 2 weeks, or you're going somewhere and it's going to be a month before you can get that thing done. Whatever's happening, the process is so stressful that it just creates so much more stress on top of the fact that you're having to do it and worrying about it anyway. Here, what
Right.
they do is you go in for a mammogram, and then you literally go across the hall after the mammogram, and they do a sonogram with a doctor. And then that
Okay.
doctor is looking at your sonogram and your mammogram, and will give you a full on like result at that moment,
Oh, like
right
right.
there and then.
That. Oh my God.
So you go
That's
in, and
insane.
within 45 minutes, you are done with the result.
And then you go about
And
your
then you
day
go
with the
about your day
information
with
you
the
have.
information you have. And I was like, oh, that was just, it would just actually took out so much stress from the scenario for
Hmm.
me, that I was just like, oh, that was worth it. That was worth moving just for that. I'm still waiting for someone to come up with a system that doesn't include a mammogram, but since we have, that's what we have, I was like, so there
Right.
are also things that, because they have a system like you were saying that isn't related to making money and order da 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 as much, the way that they do things can be much smoother and much
Hmm.
easier, I think.
I agree. I will say another thing that I was really impressed by here. I haven't dealt with the public system as we know, but in the private, at the IMED, when they're like, you have to get your blood work, and getting your blood work, like going is a bit of an issue because they don't do it in the office, right? So you have
No.
to go to like their little blood bank cattle call
Yes.
room that you have to go to, and it's only open a certain amount of hours, like in the morning. So you kind of have to plan for it.
Hmm.
But you go there, and it is like an open call audition kind of thing. I mean, I don't know if you have experience with that, but there's like 100 people in the big hospital. There's like 100 people waiting, but they have like 30 rooms, and you're like, oh, I'm going to be here all day,
Hmm.
and you're out in like 10 minutes because
So
they are
they are
getting those
efficient.
people in and out, and some of those results are like you're getting them that night or the next
Hmm.
morning, and I was like, this is amazing, and they're coming through your app, like you're getting an email, check your app, here's
Right.
your results are in, and then it shows you the results, and then I'll show you this one's still pending, check in
Hmm.
2 days, this is a 3 day one. But it was one of those things where like, oh, now I know, and then I can see, because then they give you the little thing like they give you the parameters to
Right.
let you know this isn't good, and you know that you have to go to your
Hmm.
doctor to follow up, but now you know before you go, like, where am I at,
No, the
so
sheet
that
that they
was
give you is amazing. Yeah, with the this, you should be within this range, and there's a star if you're not, and then this, and
right.
then. But I don't. The other thing, I don't know. Maybe I don't know how bad it has to be for the doctor to call you back. Hopefully I never
No.
find out. But I'm assuming there is a point where the doctor sees it and calls you back. I don't know.
Well, in my experience, anytime I've had blood work, there's already been an appointment scheduled for
Oh,
like
okay.
3 weeks or a
Yeah.
month. Or I've had it too where she's like, you're coming in 7 months for your physical,
Oh, okay. So they
so
are
make
taking care of you a
sure
little bit then.
they are, because what she'll say is make sure you book your appointment in 7 months and
Yeah.
6 months, and make sure you get your blood work done. So I have to remember, like I have to
Mm,
put it in my calendar to remind myself, because I'm not going to get a reminder. But she'll say, make sure you get your blood done 5 days or 3 days before, depending on like
yeah.
if there's going to be a longer test. And then so when I get there for my physical, she's already got my blood work. So it's not like an after. And then there's like, if I need more blood work because I'm getting
Yeah.
old, and then she'll say, we have to get this, or I don't like this, let's wait three
Yeah.
months and do this test again. But I'm going in a lot of times with the blood work already done. So she's gonna read me the go over the results as
Yeah.
he or she's checking my vitals
I
and
think
all the
that's
other
a
things.
different scenario. I have to say that I can't just go get blood work done. I have to get an appointment, and then they'll tell me to go get the blood work done, and then I have another appointment. So I'll make two appointments, one, and you can like make one appointment and then another one for 2 weeks after or something. But I have to go to the first appointment to get the blood work prescription. Like,
Oh, well, see, well, that's what I'm saying. She's already done it months in advance. So the
yeah,
prescription's already in this system for 6 months later.
I
So
haven't had that experience where someone's been willing to do that, but that's okay. I mean, that's just probably a different scenario, a different doctor. So that's like
different
different
health
health
problems.
problems, maybe. So it's like, no, you got to come in, and then because they want to, they also have to lock in. I went to the health system. I went to the public health center here, and I wanted to talk to the nurse. I talked to the nurse about something, and then the doctor came out, and I got the thing sorted, and then I left. But she locked in. I saw in the app that she had locked in an appointment for me that I wasn't supposed to go to, but she needed even because I went in and just spoke to her. She needed to
Hmm.
show that she had talked to me. So I
Okay.
kind of there was an appointment in the app like for that, and I think the private healthcare is kind of the same. Like everybody needs to know that there's an appointment that you were spoken to and all this kind of thing. But I love the
Hmm.
thing that you can just go to IMED between I think 7:30 and 11:30 or something any day.
Right.
No one cares. You just check in at the front. They take your blood because well whatever prescription they have, and you're
Right.
out of there. And I think it's
Yeah.
so convenient. I just think that's the greatest thing. But because I mean. I feel like as an adult, I'm just spending my whole life making appointments, doing things, and so to have something where it's like, just go in and do it whenever you want. I'm like, oh, thank
Right.
you. That's so great.
You can work your life around
Right.
it,
I
right?
could schedule it.
I
Yeah.
something else, we had brought up vaccines before. I think there is something we should talk about too, is that some vaccines, like your children's vaccines, they'll have them in office. But then there's other vaccines, kind of like your flu shots and COVID vaccines, that you have to go. outside of the office. So they'll give you a prescription and you have to go to so that's something different here that people find surprising. You know, back in the States, we're used to going to the grocery store or CVS to get your
Mhm.
a lot of your vaccines, you know, the ones that don't need like doctor, like your
Right.
shingles
Oh, I
and your
love the
flu.
CVS system,
Yeah,
right? You just
yeah.
go in there and you sign in, and you can sign in for later in the day and then come back for that appointment and just get your flu
Right.
vaccine. So convenient.
And they're like,
Yeah.
"Oh, wait an hour," which then you're going up and down the aisles, impulse
Buying
buying, buying
everything.
$7 2 liter Cokes, right?
Totally. Stuffed toy.
Yeah, exactly. But I've had that, you know, I'm like, we're a flu shot family, and so it was surprising to me when the doctor's like, "Oh, here's your prescription. You got to go to the pharmacy," and I was like,
Mm,
"Okay." And I'm thinking the pharmacist, which is surprising to me because our pharmacists here know so much yet can do so little because
right.
CVS, that's fine. They're like just having someone, they put a white coat on anybody and they're shooting you up with a shot, right?
That's true. But the
And
pharmacist, just so everybody knows, they will pierce your ears, which
they
is
will
very
pierce your ears,
helpful. So
yes.
they are allowed to do piercings, but just not
Yes.
vaccinations.
But not
I do
vaccination.
think there's
So
a
you,
difference. I don't know what it is. I mean, definitely the vaccines that are not on schedule. I have a feeling if you know, if your kid's 9 and there's a vaccine for a 9-year-old and you're going into the appointment with the pediatrician and they know that she's there for that, that they might be able to have it, possibly.
well, we just did the vaccine thing, and for Paloma, they had the I was thinking what we had that she's like, well, she needs this and this vaccine.
Hmm.
And I was like, all right, so do I get that at the pharmacy, and then do I have to come back? Because let me tell people what our original experiences
Right,
was getting our flu vaccines our first fall. They're like, you have to go to the pharmacy, get the prescription, and then come back here or go to a cine, not a cine, the salute center or
right,
something like that, and they will administer the shot.
right,
I was like, that's a lot of work to get just a flu shot. But when we went in for her vaccines, like, oh no, we have X, Y, and Z. The one they didn't have was the one that she was supposed to be on
right.
schedule for in the States, but it was the one that
Okay,
they
so
give
that's
at
what I
birth
was
here.
saying. If you're on
Yeah.
schedule for something and it's something that you're going to have, they will have it. This is when we're
Hmm.
talking about having to go pay for them and come back. So that is when you're off schedule or you're doing something special. So I took Xena down to the Centre de Salud for her vaccines for the H. They just did the ones that she needed there and then. They
Hmm.
had them all there, no problem. But then the second HPV, if she wanted it, because now that's optional, they don't have it. I would have to go get that and pay for it and bring it in if we wanted to do
Hmm.
that, because that's not now like required, because you can just do
Right.
one. So I'm sure if I made an appointment to go get a flu shot at the Centre de Salud, they would have it. I wouldn't have to go to the pharmacy. And
Do they carry
I
it?
think
Do
that's what
they
I'm
carry
saying.
those
I think
now?
they would carry regular things at a regular time.
Well, the private hospital does not. I know IMED never carries the flu shots, so that is
Right,
you
but they
go
had
in. Yeah.
the ones that Paloma needed for
They
her
have the
age. Yeah.
inoculations, right? Like
Yeah.
the keep you alive.
Hmm.
Everyone's got to get the, I guess, the
Well,
flu
but the
shot. They
flu shot
consider
also is not a mandatory thing. So yeah,
right,
so we're seeing a pattern here, which is if you're off schedule
right,
or it's something that not everyone is going to have, they're not going to do it. They're not going to hold it, I think.
right,
Yeah.
right.
So, but you know, that's, I think, it seems very organized, and those are the things that we've done through the regular Centre de Salud, and it's always been very smooth for that
Hmm.
experience for sure. So we're kind of getting. I feel like what we're doing, and this what a lot of people might end up doing as well, especially if you're not fluent in Spanish. I think is you have your private healthcare and you have your public healthcare, and you probably gradually move into the public healthcare system more as
Hmm.
you get to know the system and you get to know the doctors and you understand more Spanish, because it's, especially where we are, there's very little English spoken. So if I have something
Right.
really complicated to talk about, I just don't feel comfortable getting prescribed something for something that I'm not understanding what's going on, you know?
Right. And the private hospitals do have an array of staff that speak different
Hmm.
languages. And when you call up, you can just say, I need to speak to
Yeah.
someone in English. And a lot of times the person answer suddenly speaks English. I mean,
Right.
they just switch into English, but they are used to an international clientele. So they do
Yeah.
that, right? And that it's very nice. And they will help you find a doctor that speaks English. So when you're
Yes.
calling, you're like, my doctor said I need to see a gastroenterologist
Hmm.
that speaks English. And then they'll say, well, we only have one at this center,
Right.
not that center. So sometimes you have to go to different hospitals if you need to speak to
Yeah,
someone in
I do
English.
wish they would
Um,
fix it on the app, because I would like to be able to do that without calling. But both
right.
my health insurance and IMED, both of them I can call up and ask for English, no problem whatsoever. Now, there was something that I had to do. I was doing an allergy test at IMED, and there was something that they didn't do there, and I was sent over to the Spanish hospital to get a
Hmm.
breathing like thing evaluation thing done for my allergies. So that was there are possibly things, but it was still covered completely by my insurance, but I couldn't do it there. I had to go and make an appointment with the Spanish hospital and get it done there.
Hmm.
So it's not they don't do everything, but I think, and that maybe goes back to some of the more serious, bigger things. They're maybe not really equipped for that necessarily, but
Right.
it's no
Well,
problem.
one of my daughters needed a blood test that the hospital didn't do,
Mm-hmm.
and it turned out it was like a birth blood test too.
Oh,
So they're
okay.
like, we don't do that. Only newborns get this
Oh,
blood
okay.
test, and I
Was
was
she a
like,
newborn? You're like, well, she's a
I
little
was
past
like, she had
that.
a newborn, but they're like, they were ruling some stuff
Yeah.
out, and so they're like, you have to go. And then it was the pediatrician was like, I am also a doctor with that, so give me her SIP number, and I will arrange all of it for you. They ended up doing the blood test at the private hospital. They ended up doing the test at the private hospital, but she had to get it arranged for, so we had to go
Right.
back. But it was like really nice. She's like, I can get
Mm-hmm.
that done for you. Don't worry, but
Yeah,
I
no, I
need
think
what's
you
her
can
SIP number.
totally get it done, right? I mean, it's and
Mhm.
that was a benefit for her having a SIP number, even though you were doing it through the private health center, you needed to go to a public hospital, and to do that, I think you needed the SIP card to get
Right,
registered.
because it's kind of like a
Yeah,
new birth. The SIP, it's like a Spanish healthcare blood test thing, right? So it's
yeah.
like they needed whatever that is for it to come through that system
Yeah,
versus
and I think that
the
was
SIP.
really good advice you had at the beginning. Just sign up, because you never know when you're going to need it. And the last thing you want to be doing is scrambling for something like that in an emergency. It's just
Hmm.
not necessary. So you're going to come here, you're going to get your padron, you're going to find a place to live, you're going to, sign your kids up for school if you have kids, you're going to be doing these things. Just sign up for your SIP card. It's super easy. You take your
Right.
padron down to the Centre de Salud, and they just do it, and then you'll get a
It
card that is specifically for somebody that's not paying into the system. And
right.
then if you ever get to the point where you're paying into the system, you just take all your autonomo or whatever proof you have that you're paying into the system, and then they switch the card, and then you get like a nice plastic one.
Not the skimpy little
No.
paper, the plasti coated,
No.
not even
You
laminated.
get a
It's
real
very.
plastic one.
I get a real plastic car without.
Which is funny. Yeah, so I think it's, there's a that's I think good advice, just to get just if you're planning on living here and staying here, just get into the system, and it will make things a
Mhm.
lot easier at some point for sure.
And I don't know about your experience. I mean, there has been a few doctors where we've had to wait in the waiting room for like 30, 40 minutes. And that tends to be a super specialist one. And it was really worse the first couple months after the Dana. Like that week
Mm.
they were closed, like messed them up for months appointments wise. Um, but they're for the most part, my GPs, most of my other doctors, we're pretty much in and out. I'm not like, oh, I have a doctor's appointment and we're gone for the rest.
No, no,
I'm
it's
like
been
ruined
really
for the rest of
organized.
the
I
day.
mean, like you said, occasionally, I mean, I generally, this has just been a rule of thumb for as long as I can remember, try and make appointments first thing in the morning, because things can get less
Right.
backed up. And
Right.
with the best intentions, things are going to be more backed up later in the day, that's for sure. So we do that.
Um, or right after siesta if that doctor does the
Right.
siesta timing.
We get so much done during siesta, let me tell you. Yeah, because also the pharmacies are open, like the right ones are anyway. That there's always one open. And then I think one other thing we
Right.
might want to touch on. It's not something that I fortunately have a lot of experience with, or maybe I should and I haven't. But mental health and the services in that regard. I don't know if you've had or you have friends that have had
So
any
I
experience
I
there.
myself am someone that goes to
Good for
therapy.
you.
I'm a proud
Hmm.
therapist payer. So I'm still using my therapist through Zoom from back in the
Mm,
States. My insurance, I was like, oh, I should try to find someone here. My experience with who was on my insurance plan, I have since switched insurance, so I'm going to try
okay.
again. The English speaking, they had like four that were local. The rest were like in towns 30, 40 miles away. And so I was like, there was a very limited access to English speaking therapists. And when I went on their websites, I was like,
Yeah.
yeah, they're not going to be for me. Like I
Okay.
could just tell like what they covered or what they're like, you
You
can
can
just tell. Like
tell.
a therapist is like dating, right?
Yeah.
It's a love at first sight
But
kind
you
of thing.
could
You're like,
do, if you're
yeah.
doing Zoom into America, you could Zoom into Madrid, I suppose. Was that an option?
I mean, I guess, but I already have my therapist. And I was like, that just seems like a
Right.
lot to overcome. Where I'd rather be someone
Right.
local.
Except
Do you know
you're
what I mean?
paying for the American one and you wouldn't have to
True.
pay for the one here. So I think the advice there is make sure you keep your therapist while you figure out if you can or not switch here. So make a plan financially and like with your therapist and your financial planning and your day and everything to maintain the one you have while you figure it
Right.
out because if you don't speak Spanish, you will be very limited for
Right.
sure. And if you do speak Spanish, I'm sure you can find somebody, but it's still going to be a new therapist. So it's still going to take you
Right.
time. And,
And I
you know,
will say, I'm sorry, in my experience as well here, there are a lot of English speaking therapists here. They don't take insurance, so you're going to
mm,
be paying that money
oh,
anyway.
I see. So that's an
So
option as
so
well.
that's
Yeah.
yeah. So I've looked in that as well. And, oh, I've got this therapist, but my insurance isn't covering it, and I'm like, well, and the,
Mm,
for what I pay for my therapist isn't much different than what I'd pay here. So I was like, then I might be buying 10 sessions with 5 different
right.
therapists that are never going to work out. So I might as well just keep who I've got and keep going. But I'll keep
Well, I
trying.
was gonna
I'll keep
say, just
looking.
go for the enjoyment of it. Maybe you'll learn something else from that therapist, and you can have two therapists. I don't know. The more, the merrier. Wow,
Then I won't have time for the
that's
podcast.
true. This is your therapy now.
This is my therapy.
I think on that, should we end on maybe we have just some practical tips, kind of wrap things up in a bow of advice, maybe?
Like 911, is it
Oh, yeah, that's a good
911
one.
here?
Yep.
it's it don't dial 911, it's 112
Yeah.
is your urgent,
Yep.
emergency
And I have
number
had to
here.
use it and they will speak.
Have you?
Yes. So we lived in an apartment before we moved into our house, and there was a really lovely old lady that lived below us. And she only spoke Valenciano. So I had very little.
Oh,
She
that's
wanted to speak with me all the time because she was one of those people that would go down and sit at the front door. And she was super sweet.
Mhm.
And I was like, and my Spanish really then was pretty terrible. And I was like, I just feel so bad. I would love to just sit and chat with you. And then I said to the landlord one day, I was like, I just feel really bad. Like, she's like, oh, she only speaks Valenciano. I was like, okay. So I feel
well, I have no chance.
there's only so much you can do, right? And then one day
Mhm.
she obviously, something happened and I could hear tapping and things. And I was like, something's going on. And I knocked on the door. She was like, help or something. And I was like, oh my God. And then calling everyone, does anyone have a key? And didn't work out. So I ended up calling 112, and
Mhm.
I said I have to speak in English because I can't explain this in Spanish. And they found somebody, and then they sent over the fire people and the police and everybody. And they
Mhm.
ended up like using our balcony to like sort of rappel
Like
down
lower
into
themselves? Oh my
and then
gosh.
they were like on the balcony outside like Zena's bedroom, and she was just sleeping. And I was like, okay, well, she's sleeping, there's no need to wake her up for this. Of course she wakes up in the middle of, there's like 5 firemen out on the balcony trying to get like down. And so it all ended up okay. But I think it's important to know that you can still help people here, and you can,
Mhm.
call 112 and get help for somebody or yourself without stressing out about the Spanish.
Okay. What's another tip?
I would say always carry your SIP and health card. I mean, I have them also photoed and I have them in my notes on my phone, which can also work.
Mhm.
Sometimes it's okay just to have the number of the card, and download the apps because you can do everything in the app. And also at iMed, when you check in, they have a waiting room on the app that gives you a number, and then they don't give you any cards or anything or any number. So
Right.
it's all in the app for that.
And they're moving more and more to the app because I haven't gotten a card even when I've gone to the front desk. They're like, it's in your app.
Right.
I'm like, oh, okay. I'm like, but I want the cute little card to hand the doctor
I
saying this is my
know.
number.
Yeah, so you will need to like go in, you will need to show the doctor that you have that number so they
The
know they've
number,
got the
yeah.
right person connected to the right number. So it does work really well. So just download the apps and keep your cards on your phones and everything. That's my advice.
I
Yeah.
concur with that advice.
And also, if you're coming from another country, and if there's anyone listening that's coming from a country that doesn't have the alphabet system that we have, perhaps try and get your medical records translated, or you will want to try and find a doctor here that speaks your language. Because when we were
Hmm.
doing the vaccination thing, the doctor was like, I was like, I'm really sorry, this is all in English, even though she was speaking English. She's like, oh, no, I've had to deal with lots worse.
Okay.
So I was, they're used to English, but I think some of these
Hmm.
other places, I think if you can have if you have any kind of medical issues and you really want that medical record to be dealt with properly, have somebody professionally maybe translate it into Spanish for you so that you know it's
Right.
correct, rather than assume that you're going to come across like a Greek speaking doctor here that can do it for you, you know?
Right.
That's my advice for the language thing. Be prepared.
I think that's good advice.
But I think overall, I think to sort of tie it up, I mean, I think we both had really good experiences with it. I've been incredibly happy, much, much happier with our healthcare situation here than I ever was in the States, for sure.
I'm very pleased. I was lucky with our health insurance in the States for the most part. No, put it this way. I was very lucky with our last health
Okay.
insurance that we had in the States.
Okay.
That was hard to leave. I mean, that
Okay.
was hard to leave the States, but that was a hard system to leave because once I got into that, I was like, oh, is this how life could be? But I had many years before of like, unless my foot has been completely sawed off, I'm not going to the hospital because I can't afford it. I'll
Right.
just walk with a limp for the rest of my life because that'll be cheaper.
Yeah.
Right.
And forget
So,
preventative care. I had a wonderful doctor in the
right.
States, but it, you know, that was sort of half covered, and she did sort of homeopathic and she was a doctor too, and that was a really nice combination that I love, that I haven't really found here so much. But I have also found that
Mhm.
the doctors here are a little less writing prescriptions for everything. I mean, so I think overall all the doctors are a bit more like preventative. Let's not be dramatic,
Right.
you know. So I think overall it leans a little bit more in that way, that I from my experience. But yeah, it's been good.
I concur. Again, I'm
Again, I was
concurring.
being so agreeable, and I don't understand, and I don't like it.
I'm just saving you up. I'm tricking you.
Yeah,
I'm
exactly.
tricking
And
you.
so the other shoe.
I mean, I like to get you into when you're weakest. You know, when your defenses are down.
I'm waiting for the other
Then
shoe to drop.
Yeah. Well, Tanya, as always, it's a pleasure.
Absolutely.
You know,
Yeah, that was fun.
gabbing with
Yeah.
you about these things. And till the next time, everyone.
Hasta ahora.
Hey, can't get enough of us? Follow us on Instagram and Facebook at Ospain Podcast.
And on our website, ourspain.com, which we will be updating with exciting new things as we grow.
We would love for you to message us with any topics you would like to hear about.
See you next time.
Bye.